All right. Well, good morning, beautiful people. It is another fantastic Monday morning here at Health Plan Markets. Thank you guys for being on the call this morning. And thank you for getting ready for this last week of normal time before we go into the busiest time of the year. Uh, just starting in a week, believe it or not, we'll be in October. So this is the last week for preparations, the last week to make sure that you've got everything you need to be successful here at HPM. Very, very excited to share some information this morning, and we have a special guest as well, which we will introduce in just a moment, and we will get this thing rocking. So as we normally start here, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission, and thank you for being on this call. Just a quick reminder, if in case it gets pretty busy here in the next couple of weeks, which we anticipate, clients come first. So if you have to miss a Monday morning call, please know that it is being recorded and we are hosting those on our YouTube channel. So if you need some help getting there, find our YouTube channel and we'll have these calls there. So you have the information whenever we launch it at you in an email or text message. So just know that it's there and it's available. So there it is. Let's go ahead and jump into training because we've got some training still happening across the world here. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. So this week, this morning, Aetna is doing their virtual rollout session. So if you have any questions, please make sure that you go and visit a market-specific training from Aetna. If you haven't done that yet, it is really important that you get that done. We want to ensure that you have everything that you need in order to be successful this AEP. So keep that in mind. Also, you've got United Healthcare happening at 10 o'clock this morning over if you're in the downtown Orlando area, the Orlando Museum of Art is hosting United Healthcare there. So this is their last hurrah for the Central Florida market. Go there if you need to know what's going on with United. Humana is doing a sneak peek for 2024. Again, these are last minute rah-rah sessions for the carriers. If you've seen their first looks, if you've been to a session, you should know already what's going on. They're also doing another one in Spanish, in Espanol. So if you prefer, or if you know agents that need to have this information in Spanish, this is going to be helpful. That one is also at 12:30 today. So they can jump on there and register for that. United Healthcare is doing their virtual office sessions at 4 o'clock. And then again on Friday, they're doing one at 3 o'clock. Moving over to tomorrow, the 26th, United Healthcare is doing another kickoff. This time it's in their Maitland office, 10 a.m. So check that out if you can't make the one today. Also tomorrow, Devoted's doing their 2024 plans. You can jump on that. That is at 3 o'clock tomorrow as well. And again, another training. This one's more geared for just retention. We're going to talk about that and what we've already launched in order for you to stay connected with your clients here moving forward for 2024. We've had some really great stuff happening here across the board for retention. So we're going to share with you what's already happened there. Moving over to Wednesday, the 27th, Ask Al is still there. Grab a virtual coffee and a virtual chat with Al at 9:30 on Wednesday. Remember, guys, he is your end all be all. So if you have any questions, if you have anything at all that needs to be addressed, whether you're concerned about, leads or, helping people apply for Medicaid or what plan you should put a person on, Al is your resource. Okay, so really great resource. And he'll be there 9:30 to 10:30 every Wednesday throughout AEP, just to ensure that you've got what you needed. Okay. Here's another training. This one is for United Healthcare, again in Spanish. That one's at 10 o'clock at their office, so check that out on Wednesday. Cigna's doing their virtual office sessions on Wednesdays at 11. You also have shop training. Now, if there's any training that you visit this week, any training at all, this is the one. Okay. Wednesday, 11 o'clock, mark your calendar. Wednesday, 11 o'clock, mark your calendar, Eastern Standard Time. This is the first version of our training for Shop 24. We're going to have Jason, who was with us at the AEP Tee Off on Friday, and he is rolling through our first version of Shop 24. And so there's been some nuances, some changes, and things that you need to know in order to prepare for 2024. So Shop training is essential. That's at 11 o'clock coming up this Wednesday. Mark your calendar. Please be there because you guys are going to have lots of questions and we are not going to be able to be timely during AEP with some of these questions. So we don't want you waiting for us. It is essential that you know what's going on with your enrollment platform. So that's Wednesday at 11. Check that out. Jason will hook that up. It is going to be recorded from what I understand. So we'll be able to launch that at you later down the road. But, you know, you have less than a week to prepare and get ready for your enrollment platform that you'll start working with. Okay. All right. Also Wednesday, 3 o'clock, Metro West is hosting Dr. Quanning for Devoted. They have a new partnership that they've just entered into, and that's on Wednesday at 3 o'clock. If you're in the Daytona Volusia market, that's a fun little event to go to. Thursday the 28th, Health First is doing their kickoff. This is at 9 o'clock at the Hilton in Melbourne. So if you're in that area in Brevard County, Health First, the kickoff is there. Check that out as well. Another Devoted training for the 24th. This one is virtual. So if you want to check out the plans, that's on September 28th at 3 o'clock. Friday, what about shop? So again, every Friday from now until the end of the year, we are going to be hosting trainings. Mr. Tom Ryan is putting that on. And so again, you have another opportunity on Friday to meet and talk with Tom about what you need to know about shop and to get your enrollment set up and running. That's at 9 o'clock on Friday, and we'll continue going on those as we go through. And then Friday, last but not least, is Gold Kidney. Now, we had mentioned that we are open for contracting for Gold Kidney. We have Katie on the call who's going to be talking about and their products this coming open enrollment. And so you'll be able to enroll people, like we said, with a special needs product that is unique in Florida. And so they're hosting their product rollout session in Jacksonville. This one's in Jacksonville at the River Club. So if you're in that market, check it out. And I believe they're going to have a few more rollout sessions as well as we get that info from Katie and the team. So join them 10 o'clock in Jacksonville. That is a product rollout. They are brand new to Florida, and we're excited to welcome them here because they can really help your members, especially if they have ESRD, kidney disease, heart condition, or diabetes. So another CSNP product to add to your portfolio because really there's not a lot of them out there, especially on the ESRD. So really excited to add that product out to our portfolio and to help our members get the care they need. So that's it for the week. Remember, guys, keep one foot in the classroom and the other one in the field at all times. Moving on, I want to say thank you to everybody that joined us for our tee off on Friday. We really, really appreciate you making the drive. We had wonderful weather, had a beautiful event, and a great turnout. So I appreciate everyone that made it out to the event. We had over 100 and something agents there. And we got some great feedback from our motivational speaker there as well. So 4.9 on this event. So if you went to the event and you didn't get a chance to do your feedback, please do, because this is your chance to let us know how the event went, what you thought about it. It seems like we've got a lot of great pieces of information and also some stuff that we need to improve. And that's really where I want to focus on. So how do we make this event better for next year? Please let us know. You know, this is your chance to say, hey, I didn't like this, or hey, this could have been improved. If you don't tell us, we don't know, and we're just going to continue down the road thinking that, hey, it's fine. So really appreciate your feedback. Thank you for attending. I know everybody left with something, which is exciting. And some of you left with free gifts and, you know, basically just left like you robbed a bank. So pretty excited about that for you guys. Want to go through the final CMS ruling that was launched, and I think the company that is really giving us information best is Aetna. So they rolled out an email on Friday regarding the CMS guidelines, the final guidelines that has been set in place. And as you know, the 48-hour rule is coming back. But you know, I'm not going to read all this to you because you got the email as well. But I do want to point out one thing, that scope of appointments are required for folks that are interested in talking about a Medicare Advantage plan, and you need to have a 48-hour window for those folks. However, if it's an inbound call, you do not need to wait 48 hours, and you can enroll them over the phone. So for instance, if you did a postcard or a flyer, or you got a lead from a client and they call you and they want to get the job done, you do not have to wait 48 hours for that inbound call. So I wanted to point that out because I think there was a lot of confusion about that. So make sure that you have that set up. Yes, you have to be licensed or certified and appointed to send out scopes and to collect scopes, because it's the agent's signature that has to be on there. So just pay attention to that. Events. So talking about a change in the events, you used to be able to collect scope of appointments at educational events. You can no longer do that. Okay, so you cannot collect a scope at an educational event. You can collect, I believe you can collect the permission to contact there, but you cannot collect the scope of appointment. No apps, can't talk business or benefits or anything like that. You cannot put a marketing event back to back with an educational either. So you have to wait at least 12 hours to do it in the same location. So I want to point that out. Marketing materials shouldn't be too much of an issue. If you have questions or concerns, just email the team. We can create that. Same thing with the disclaimers. All of our marketing materials have the disclaimers already approved on it and ready to go. Call recording, it is still required. However, just remember that they slimmed it down. Not all conversations need to be recorded anymore. Just if you are making a conversation which includes marketing, sales, and enrollment information about Medicare Advantage plan or prescription drug coverage, you do need to have that call recorded, and you have to have a system to retain that recording for at least 10 years. Okay, this is your responsibility. This is what you signed when you joined the health plan. These are the requirements by CMS to do these enrollments. We're here to help you, not to get you in trouble. So if you have any questions, concerns, please let us know. Remember, the full CMS guidelines have been emailed to you. And I think Aetna does it best as far as the information that they sent out to the agents. So check your email for that Aetna. It's labeled FAQs on CY, calendar year 2024, final ruling for marketing and communication. So please make sure that you do that. Also want to share with you an email that was sent out from, or is being sent out from Spark. Spark does have our retention in play. And so you should be getting your survey results, which look like this. And so it's pretty exciting. You've got, basically what's happened in the last yesterday, how many submissions were sent in, and are your members satisfied with the plan? And if they're not, they'll let you know right there. Okay. Also, another email sent out, I want to point out, from Health Sherpa. And Health Sherpa is now doing what it takes to help you retain your AOR. So there was a new email that was sent out last week. Let's see, it was sent out on the 21st. And so the first phase of this, there's two phases. The first one is starting on September 20th, which has already started. They're now going to list the assister, or the person that did the application on Health Sherpa. And so if that changes, you'll clearly see who is listed on the policy. And then in phase two, they're going to start sending out notifications when your member changes agent of record. So that's really, really cool. So keep an eye on that from Health Sherpa. The last thing I want to mention before I bring on Katie is we now have, we now have about a week until pre-AEP, and then we have almost 3 weeks until open enrollment itself. Okay, and why am I mentioning this to you? First and foremost, we're getting really, really close here. So number one, check your ready to sell permissions. Okay, you're going to have a problem if you go into the actual enrollment or into the enrollment software system and you're not seeing the plans that you're RTS for. So you have to let us know that you're RTS. Okay, so again, go into shop, check your RTS. We've done videos about it. If you need any help with it, please let us know, and we're happy to help you with that. But don't go into open enrollment without knowing for sure that your plans are displayed, because that's going to jam you up as soon as you get into open enrollment and you're not seeing the plans that you're RTS for. So please, go in there, make sure that you've got your RTSs, and then send us a note in case there's anything missing. All right. So with that, I'd like to invite in Katie from Gold Kidney. Katie, can you hear us okay?
I can. Can you hear me okay?
Sure can, absolutely.
Bear with me for a second. I'm going to be brave and try to share my screen. If
You got it.
Yep. I'm not used to.
Yeah, Ring Central's a new one here, but yeah, we got it. It looks like it's loading fine. Yes.
Ooh, awesome.
Outstanding.
Thank you. Just good morning, everyone. I really want to first off thank Justin. I spoke with Al and Nick for inviting me to spend a few minutes with you all this morning to give you an overview of Gold Kidney Health Plan and the portfolio of Medicare Advantage plans that we will be offering in Florida for 2024. Just a little bit of an introduction myself. As Justin said, my name is Katie Stroud. I'm the sales director for Florida for Gold Kidney Health Plan. Really excited to be here today and with the company. I've spent the last 18 years or more in the Medicare health insurance industry. Like you all, I was an agent in the field for several years with Humana. Most recently, I spent the last decade with United Healthcare as a market sales manager and recently resigned to start working with Gold Kidney Health Plan. I have a background in social work, so my favorite plans to talk about, whether it's with a client or agents, have always been special needs plans. And that's because we are helping our clients and members in the community that either are lower income, chronic health issues, and they need the most help with the benefits and resources that we're offering them. So over the next 10 minutes or so, I'm going to give you a brief overview. And at the end of this, I'm going to direct you to our training website because we do have a couple more virtual rollout sessions that are available for you to attend. All right, good. So up on the screen right now, I just want to introduce you. They couldn't all be here today, but this is our Florida sales team. I'm going to show you a map on the next slide where our footprint is, but in each of the three major areas where we are entering into Florida, we have a market manager to support you. In South Florida, if you happen to offer plans in Broward and Palm Beach, Ray Gomez is our market manager there. He was recently with United Healthcare for the last, I would say, 17 years, resigned, and is now here with Gold Kidney. If you do business in the west, on the west side of Florida, in the greater Tampa Bay area, Justin Hall is with us to support you. And then some of you may recognize Denaria Kamore. She was also a market manager at one point with United and has chosen to come work with Gold Kidney. So we have support from a national level down to a local level to help you partner and help you grow your book of business with us. So first of all, Gold Kidney Health Plan is headquartered in Arizona. We've spent 1 year out there. We're headquartered in Scottsdale and moving into Florida for 2024. Gold Kidney, as you can tell by our name, we were developed by a group of nephrologists that meet with patients with chronic kidney disease, many of them on dialysis, that can't afford the care and treatment that they oftentimes need. So these nephrologists came up with a health plan that has low and affordable copays for the treatments that these individuals use the most. Also helps them with other social determinants of health, transportation, groceries, all sorts of things to help them improve their quality of life. So in Florida, we will be in the Golden Counties: Sarasota, Manatee, Pinellas, Pasco, Hernando, Clay, Duval, Palm Beach, and Broward. So we will have a 9-county service area in 2024. With a peak in the box in 2025, we do plan to expand into another 12 to 15 counties. So this is just the beginning for us here in Florida. In this footprint, we have 1.7 million Medicare eligibles. We are going to have a portfolio of Medicare Advantage plans that can serve anybody with Medicare. Okay. But our main focus is providing chronic special needs plans, or CSNP plans, to individuals that have kidney disease, end-stage renal disease, and they're on dialysis, And as you know, there's really no special plans available for that in Florida at this time. So it's going to be our niche. But we also have special needs plans for the diseases that go hand in hand with kidney disease, and that's diabetes and heart issues. So of the 1.7 million Medicare eligibles in our footprint, approximately 30% of them will have a chronic issue that will qualify them for one of our C-SNP plans. This is just a very brief overview of the plans that we will be offering in Florida and Arizona, but I'm going to focus on Florida. All of our plans are an HMO point of service. So yes, we have a network of doctors, but this is a flexible HMO. No referrals are required. In addition, for every single benefit on our plan, not a select few, but all of them, members can use the POS to go out of network and pay the same cost share as they would in network. So we're giving our members these wonderful benefits, but we're also giving them access to care. Whether you're in network or out of network, you can use the benefits and pay the same. We have over 11,000 providers already in our network, and it's that network we're trying to expand every day. So if you look on our Find a Provider on our website and you have any suggestions, shoot me or a market manager an email and we'll try to get them in. So up top, we do have a C-SNP plan ending in 001 called Super Plus. The Super Plus plan caters to individuals with Medicare that have cardiovascular disorders, CHF, or diabetes. That plan has an $150 Part B buy down, offers some other rich benefits, which I'll talk about in general in a second. We also have what we call the Super Complete plan. The qualifying factor for this plan is that you have to have Medicare and one of those chronic conditions, but this plan is appropriate only for individuals that have full Medicare and full Medicaid. Okay. If you skip down the line, we also have ESRD plans for individuals on Medicare that require dialysis. We're calling this plan Dialysis Plus. This is important because since the year 2020, individuals on dialysis can join a Medicare Advantage plan, but it's your run-of-the-mill plan. Generally, they're paying 20% for dialysis, so they're reaching that MOOP. The plan may or may not have transportation or the extra services that these individuals need. With our Dialysis Plus plan, individuals pay zero cost share for dialysis. They have unlimited transportation and a whole host of other benefits to help improve their quality of life. Dialysis Complete is for individuals on Medicare and on dialysis, but they have full Medicaid as well. If you look on the bottom half of this, we also have our standard Medicare Advantage plans. These are for anybody on Medicare. They don't have to have a chronic issue, and they're actually fairly competitive in a lot of the markets we're entering in. It's called the Honest Care Plan, ending in 005, has a $150 Part B give back and very great benefits. And then finally, in Florida, we have our Loyalty Care Plan, and that's our version of our veterans plan. It's an MA only with an $150 buy down. I'm going to spend about 2 minutes or 3 going through this and then encourage you to go to our website to register for an upcoming event to hear about our benefits in greater detail. So these are our value propositions. Everything I talk about on the slide, that these qualities are included in and features are included in all of the Medicare Advantage plans I just listed to you. Okay. Affordable. All of our plans obviously have a $0 premium, $0 copay to the primary care. But what's a little bit different about us is for the specialists that many of our members use the most, such as nephrologists, cardiologists, and endocrinologists, it's a $0 copay to those specialists. Any other specialist is an affordable $10 copay. So, and this is in or out of network. So when people are saying, well, where do I market your plan and prospect? If you're looking at provider marketing, yeah, primary care, work with primary care doctors is always great. But with our plans, you really want to look at those specialists and try to work with them to see if some of their patients would fit into our plan. As we said, $0 cost for dialysis treatments and medications, unlimited transportation for these individuals as well. something also different about our plans. On all of them, we have a tier 6 for insulin, brand name and generic insulin, $0 all year round. On the topic of diabetics, tier 3 diabetic medications such as Ozempic, I say that wrong every time, by the way, Trulicity, and a lot of those drugs that cost thousands of dollars a month for diabetics, those are covered in tier 3 with us, and they're covered through the gap. In addition, if people choose to use our mail order, it's a 1-month copay for an 100-day supply. So those expensive diabetic drugs, $40 for an 100-day supply all year round. And that's a life changer for many of these individuals that struggle with their prescription costs. All of our plans include a grocery benefit, the Flex card for dental, hearing, and vision. It's a MasterCard. There is no network, so they can go wherever they want with it. We do Papa's Pals. We have transportation on all of our plans, even just your run-of-the-mill MAPD plan, OTC fitness meals. We have limited prior authorizations, which allows our physicians to really be at the center of their patient's care and direct it as they feel necessary. And then the final thing I want to mention today, because I'm just trying to give you a little bit of the good stuff to entice you to come to one of our virtual trainings, because there's so much more. We have an exclusive relationship with a company called Duo Health. And what that is, you know, I used to work for other carriers. So I would say it's a mix of the navigator type programs and the house call programs, but on steroids. A lot of those other programs will come to your home once a year, or you call a 1-800 number and speak to somebody across the United States. With Duo Health, we assign all of our members with chronic conditions a social worker, a primary care doctor, and a nurse practitioner in their local community. We give them a care team at no extra cost that will come into their home as often as they need. It's a concierge care management team. The nurse practitioner can write scripts for them in their home. The social worker can help, you know, hook them up with mental health care if they need it. The navigator can help them make doctor appointments. It's closing their gaps in care with a local care management team. So, you know, we're trying to provide the benefits, the services, and the care to really improve people's quality of life with chronic conditions and slow their disease progression. So that's it in a nutshell from me this morning. What I'm going to do is go into the chat and, oh, HRA, sorry, now I'm finally just looking at chat. Yes, we do health risk assessment. If it's a non-CSNP plan, it's $75 per application. If it's a chronic plan, it's $150 per app. And we also say it's as easy as 1, 2, 3. If you write just 3 applications for us during AEP, we're also going to reimburse you the $175 AHIP fee. So 3 apps before 12/17, and we'll do that for you. So as you can tell, there's a lot of exciting things I could tell you about. I didn't really do it justice in 10 minutes or 15. But I'm going to type our training center website into the chat right now. By the way, I don't know what's going on this morning. This training center website is working on my mobile device, but not my laptop. So there's your heads up. If you can't get it on your laptop, just go on your phone and it will work. I'm not IT savvy, so I don't know why that's happening, but it is.
Perfect.
Justin, can I just say one more thing?
Absolutely, please go.
Sorry, I have 1 million things to say if you can't tell, but on the training website that you had up, and I appreciate you plugging our event in Jacksonville, it's a makeup session because the storm that came through a while ago, it's actually a brunch and kit, and it's on Wednesday, September 27th from 10 to noon. So if you stop in, we'll feed you and we'll give you enrollment guides. You can meet Daneria. So it's an open house setting. Stop in anytime during that time. So just want to thank you very much. Hope to meet you all in person someday. Thank you.
Katie, awesome. Just a few questions, because I did notice that, you know, and you answered the HRA question, so I appreciate that. We had talked about, because we use Shop, which is built by Connecture,
Mhm.
Are you guys going to be on Connecture for 2024?
Yes, we are. We're on Connecture. And then also, if you, for some reason, you want to come to our platform, it's Evolve. The only one we're not on because we missed the deadline, we'll be on it soon, Sunfire, but that will happen next year.
All good. Yeah, we're Connecture fans, so we call
Yay.
it Shop 24. Yeah. And do you know if the HRA is available on Connecture? Is it built in, or does it
Not
pop you
yet,
out to get it done? Okay.
but it's available on Evolve, or we have a writable PDF where you could submit it via email or even fax. And I think it's pretty lenient compared to where I came from. We give you a 14-day window from the agent's signature date to turn it in.
Yeah, that was my next question. That's awesome. Okay, so 14 days
And you know
to
what I'll
get
do,
the HRA
Justin?
done. Hmm.
I'm going to send you an email after this. We have some broker approved material that kind of outlines how to do that, and I'm going to send it to you.
That's awesome. Absolutely. We have a resource center that we're building out, so we'll pop that in there to make sure everybody's got it. So no, this is amazing. Guys, if you're selling in Tampa, South Florida, Jacksonville, remember, you don't have to live there anymore, but you're getting leads from these areas. Think about Gold Kidney. I mean, the benefits are really strong, and that Duo Health is something that's very unique, especially if you have a high needs member that just needs some TLC and they can't get into, the doctor as often as they like to. That's going to set you apart by offering Gold Kidney. So I think that's amazing. And then lastly, Katie, I know your secret sauce here is the nephrologist, obviously. Can you talk a little bit about if there's any opportunities for our team to work with those nephrologists, or what would you recommend as we get ready to go into AEP?
Okay, so there's going to be, we actually are, a lot to get into. We do risk-based
Mhm.
agreements with specialists versus primary care sometimes, and we're working with an entity called NKP, or National Kidney Partners. Eventually, we hope to be in their offices. There could be some opportunities where we assign an agent to do. They have 52 locations through the state, but we do work with other nephrologists as well. But this is what I'll say to you: don't limit it to nephrologists. I would be looking at in and out of network nephrologists, endocrinologists, cardiologists, even retinal specialists, because they deal with diabetics a lot. Go in,
Mm.
talk with them about the highlights, and they're going to see how our plans can really help their patients in a lot of ways they're not being helped. We're going to have some collateral in the next couple of weeks to do that. So reach out to me. I'm happy to share it with you. On top of that, if you work with an out-of-network provider that wants to join our network, we probably just haven't talked with them yet. So let me know, and we'll try to get them in network if you're partnering to market with them.
Outstanding. And then Kent was saying network makes no difference. Kent, please keep in mind it is an HMO still, which means that yes, you can go out of network as a point of service, but it is up to the doctor to accept the terms and conditions. Am I right, Katie?
That is very much right. And I've also worked with point of services before, but they were more strict. But with this plan, yes, you can go out of network for everything. Two things will happen. Number one, you can reach out to the provider ahead of time and ask them to courtesy build a plan. We'll have an FAQ for the provider as well as the agent and the member on that. So they can choose to courtesy bill us if they're confused. We have a team that's willing to reach out and help coordinate that or facilitate it. But if they absolutely refuse to bill our plan, the member, just like a PPO, really out of network, they can choose to go there, pay, and submit for reimbursement, and we will reimburse them. And we pay 100% of Medicare to out of network providers.
Got it. That makes it pretty easy.
We're
Amazing.
trying. Yeah.
Yeah.
So.
Okay, well, that's it for me, guys. And then, so lastly, guys, if you're interested in getting contracted with Gold Kidney, please send an email to contracting@askhpm.com or talk to a team member. You guys know how to reach us there, or support at askhpm.com, either one, but contracting@askhpm.com, and we'll get the contract launched at you. It wasn't very hard to do, I can tell you that. I got mine done. The certification was not torturous. I survived.
It's the easiest certification you'll take in your life. I promise. You'll laugh your way through it because it's so easy. It's like, this is awesome.
It's really great. It's really great. It made it very easy to do. So I know it's one more product that you're considering, but what we don't want to have happen is you're bumping into clients and then you're thinking like, oh man, that would have been perfect for gold kidney, and you missed the opportunity, and some other agent is going to get them enrolled. So, don't miss that opportunity. Make sure that your members don't switch without you. With that, Katie, thank you very, very much for spending time with us this morning. We appreciate you. And I know we'll have other sessions in the future. Look forward to meeting you in person as well. And team, that's it. We will see you here next Monday at 9 a.m. Thank you guys for being here, and good luck. Get those certifications and contracts rolling. Take care.
Thank you.